Good day, everyone. Today, I will share to you guys the interview that I have done on 5 individuals with the questions provided by our clinical instructor. Proper consent were asked individually before conducting these interviews. So, let's start.
Hi everyone, my name is Micah and I'm a food nutrition manager here in Saskatchewan, Canada. I'm here to answer some questions for catering's output. First question, what is your understanding of the role of dentists in healthcare? As someone who works in healthcare myself, based on what I observed, dentists are the healthcare professionals who are responsible for the oral health of the patients or the residents, for us working in long-term care, or even the public.
Dentists are doctors, primarily specialized to take care of one's teeth, gums, or mouth in general. To put it simply, dentists are your real tooth fairies. They're the ones who fix those broken smiles.
Dentists help people in dealing with their oral health.
I believe that a dentist has a great role in people's healthcare in terms of dental care, since they are the experts when it comes to teeth concerns. We have to have a regular checkup every 6 months to avoid severe problem in our teeth.
Dentists help us clean and maintain the health of our teeth.
And have you previously collaborated with a dentist in patient management? Well, a little background for my profession. We do work in the food service department of long-term cares or hospitals, and I myself are assigned in a long-term care setting. Majority of my residents are in the old age bracket, meaning they're more on their 60s or 70s, somewhere in their 50s. And not all, but I think 80% of the residents here do have their dentures, which helps in their eating. So when we observe that a patient is losing weight or so, one of the things that we check is their dentures, if it still fits. So yes, we've been collaborating with dentists with regards to the right fit of the dentures of the residents, and because it's affecting their eating, and if they're not eating well, then they're losing weight and all of those. So it's like a domino effect, and like collaborating with the dentist, making sure that our patients are eating well by making sure as well that their dentures fit so that they could eat their food. It is like one of the things I could think of for this second question.
Yes, I did. One case that comes to mind is the importance of bleeding time test, which is to be considered throughout the entire dental extraction process.
No.
Since I have an advisory class, I have to bring my students to our school's dental clinic when it's their schedule for dental checkup. So I have a chance to assist my students when the dentist is attending each of them.
No, I have not.
Third, how do you envision your profession collaborating with dentists in patient care? Again, same as my example earlier, since on my profession, we do make sure that one of our jobs is to make sure that everyone is eating well. And if a patient have, aside from dentures, if they do have something in their mouth that makes them uncomfortable to eat, that's where we collaborate with the dentists. Ask for their professional inputs, what we could do, especially during the recovery of a patient on our end. How do we modify the food so that it can accommodate to the condition, the mouth condition of the patient or the resident or so.
Aside from that, I think in general, dentists do request for other tests such as complete blood count, clotting time, and also for certain complications due to infections caused by bacteria occupying the mouth floor.
Yes, there was this time when a dentist asked me to help her build her clinic.
No.
Yes, there was one time when a dentist friend asked me if I could design their dental clinic.
So basically, in this kind of situation that I've mentioned, in those kinds of situations that I mentioned earlier, we could say that we do collaborate with the dentist, and in the future, if there's more like, like if the relationship of the doctors and our profession was strengthened more, then it would be nice, because it's like one of the solutions to making sure that the patient is in good care, either in the hospital or in a long-term care or even in their homes or whatnot.
I see to it as a companionship. Amidst patient care, where quality is one that we must uphold to our patients. As your healthcare companion, we as medtechs provide accurate laboratory results to help dentists and other healthcare professionals in the intervention and diagnosis of certain diseases from positive agents or microorganisms. Overall, both our roles aspire for the goodness of health to the general public.
No, since I am not in the medical field.
As a teacher, working together with the dentist as a good dental team makes for quality of care for patients, and it can be an advantageous and an enjoyable experience.
I do not envision my profession dealing with patient care, but I think that my profession is also vital in helping build the dental clinic of dentists, leading to patient management.
So, to reflect on the answers of my interviewees, I think that they have general knowledge on what a dentist's role in healthcare is, and that is, dentist helps in dealing with the oral health of an individual in order for them to have the best smiles they could show the world. For questions 2 and 3, I think that these vary whether the professional is in the medical field or not. So, the answers of my interviewees varied a lot. Some have collaborated with a dentist in terms of patient management, and some have not. The ones who are not in the medical field have collaborated with the dentist in other terms like building the dental clinic, etc. Not all have envisioned having their profession collaborate with a dentist, and I conclude that it's interesting to see how each and every profession are able to collaborate with dentists in their own unique ways. Others in patient care and others in building the dental clinic. So, to sum it all up, I think that whatever profession one may have, they are definitely in some way linked with dentistry. In short, they may all be able to collaborate with the dentists in professional context, but not all are able to collaborate with dentists, especially in patient management. So, that is all, you guys. Thank you for listening. Bye.